Hello everyone. Today the topic of my presentation is sacral plexus. Sacral plexus is a network of nerve fibers that supplies the skins and muscles of the pelvis and lower limb. Sacral plexus is the largest nervous plexus in the body. It is located on the surface of the posterior pelvic wall, anterior to the piriformis muscle. The lumbar plexus is formed from the anterior rami of L1 to L4. It gives rise to 6 nerves, which you can see in this model. The nerves are the iliohypogastric nerve, the ilioinguinal nerve, the genitofemoral nerve, which pierces psoas major, the lateral femoral cutaneous nerve, and the large obturator and the femoral nerves. They are joined by the fourth and the fifth lumbar roots, which combine to form lumbosacral trunk. This descends into the pelvis to meet the sacral roots as they emerge from the spinal cord. The sacral plexus is formed on the anterior surface of the piriformis muscle, which form the posterolateral border of the pelvic wall. The sacral plexus is formed in the anterior vulmi or divisions of the sacral spinal nerves S1, S2, S3, and S4. It also receives contributions from lumbar spinal nerves L4 and L5, which combine to form lumbosacral trunk. The spinal nerves from S1 to S4 form the basis of sacral plexus at each vertical level. Paired spinal nerves leave the spinal cord via the intervertebral foramina of the vertebral column. Each nerve then divides into the anterior and posterior branches, which are known as rama. The sacral plexus begins as the anterior fibers of the spinal nerves S1, S2, S3, and S4. These sacral plexus emerge by the anterior sacral foramina. Now I have switched over to a schematic of sacral plexus, which we will use in conjunction with a 3D model. The anterior rami of the S1 to S4 spinal roots and the lumbosacral trunk have both dorsal and ventral divisions, which comes together to form the major peripheral nerves. In the schematic, the dorsal divisions are indicated by the darker shaded. There are 5 major peripheral nerves which are derived from the sacral plexus: the superior and inferior gluteal nerves, the sciatic nerves, the femoral cutaneous nerve, and pudendal nerve. There are in addition numerous smaller branches which provide innervation to the pelvic walls, floors, and individual muscles of the gluteal region. These nerves from the sacral plexus descends down the posterior pelvic wall and have 3 possible. The first of which is to leave the pelvis via the greater sciatic foramen and enter the gluteal region of the lower limb, either above or below the piriformis muscle. The second course is to remain within the pelvis and innervate the pelvic muscle organs and perineum. The third course is to leave via the greater sciatic foramen loop around the sacral spinous ligament and re-enter via the lesser sciatic foramen to supply lateral pelvic structures and peroneal structures. Most of the nerves take first route, leaving the pelvis by passing inferior to the piriformis via the greater sciatic foramen. We will look now at the main nerves of sacral plexus in turn and then take a look at some of the smaller remaining nerves. The superior gluteal nerve originates from nerve roots L4, L5 and S1. The superior gluteal nerve leaves the pelvis by greater sciatic foramen entering the gluteal region superiorly to the piriformis muscle. I have removed the gluteus maximus and gluteus medius so that you can see this here. It is accompanied by the superior gluteal artery and vein for much of its course. In terms of its motor function, it innervates the gluteus minimus, which you can see here. The gluteus medius, which I have removed, just brought back, and the tensor fascia latae. The inferior gluteal nerve originates from spinal nerve L5, S1 and S2. This nerve leaves the pelvis via the greater sciatic foramen entering the gluteal region inferior to the piriformis muscle. It is accompanied by the inferior gluteal artery and vein for much of its course. Its motor function is innervate the gluteus maximus muscle. The sciatic nerve is the largest nerve of the body, and it is derived from 5 nerve roots from L4 to S3. The common fibular component and the tibial component are the two major components of sciatic nerve. The common fibular component is formed from the dorsal divisions from L4 to S2. The tibial component is formed from the ventral divisions of L4 to S3. The sciatic nerve is formed on the anterior aspect of the piriformis muscle, and it exits the pelvis via the greater sciatic foramen inferior to the piriformis. In terms of motor functions, the tibial portion of the sciatic nerve innervates all of the muscles in the tibial portion of the sciatic nerve innervates all of the muscles in the posterior compartments of the thigh except for the short head of the biceps femoris. It is also innervates the hamstring portion of the adductor magnus muscle. Additionally, the tibial portion innervates all the muscles in the posterior compartment of the leg and all muscles. In the sole of the foot, the common fibular portion innervates the short head of the bicep femoris and all muscles in the anterior and lateral compartments of the leg. And it also innervates the extensor digitorum brevis muscle. In terms of sensory function, the tibial portion innervates the skin on the posterior lateral surface of the leg as well as the sole of the foot. The common fibular portion innervates the skin on the anterior lateral surface of the leg and dorsal aspect of the foot. The posterior femoral cutaneous nerve originates from spinal nerve roots S1, S2 and S3. The posterior cutaneous nerve of the thigh leaves the pelvis via greater sciatic foramen entering the gluteal region inferiorly to the piriformis muscle. You can see it highlighted in the green color on this model. It descends deep into the gluteus maximus and runs down the back of the thigh to the knee. This nerve has only sensory function. As the name suggests, it innervates the skin on the posterior surface of the thigh and leg, and it also innervates the skin of perineum. The pudendal nerve originates from nerve roots S2, S3 and S4. This nerve and the nerve to the obturator internus are the two nerves which leave the pelvis via the greater sciatic foramen to enter the gluteal region, and then they loop around the sacred spinous ligament to enter the perineum via the lesser sciatic foramen. In terms of motor function, the pudendal nerve innervates the skeletal muscles in the perineum. The external urethral sphincter, the external anal sphincter, and the elevator ani muscle. In terms of its sensory function, it innervates the penis and clitoris and most of the skin of perineum. We have taken a look now at the 5 major nerves of the sacral plexus, but in addition to these, there are a number of smaller branches. These are 10 nerves that directly supply muscles, with the exception of perforating cutaneous nerves, which supplies the skin over inferior gluteal region, and the pelvic splenic nerves, which innervate the abdominal viscera. The performing cutaneous nerve originates from S2 and S3 and innervates the skin over gluteal fold, and it is called perforating because it perforates the sacred tibialis ligament to provide its cutaneous innervation. You can see this ligament highlighted bilaterally in green color. Attaching from the sacrum to the ischial tuberosity, the nerve to the piriformis is formed from S2 and occasionally from S1, innervating the piriformis muscle directly. The nerve to the obturator internus originates from L5 to S2, and like the pudendal nerve, it exits the pelvis via the greater sciatic foramen loops around the sacrospinous ligament and re-enters via the lesser sciatic foramen to directly innervate the obturator internus muscle and also superior dermis. The nerve to the quadratus femoris originates from L4 to S1 and leaves the pelvis via greater sciatic foramen inferior to the piriformis muscle to innervate the quadratus femoris as well as the inferior gemellus muscle. That's all for the sacral plexus. You can see all the structures in this video, and in this picture all the structures have been highlighted. Thank you.